The rectus femoris is another really important muscle. Okay, they're all important muscles. The rectus femoris, though, attaches to the AIIS, and when it shortens and tightens, it tilts the pelvis anteriorly again. It's going to be crossing the hip joint and the knee joint, and its referral pattern is going to be along the knee, along the patella. I usually don't treat it for that. I'm usually treating it because of the anterior tilt to the pelvis to change the posture of the patient, because that's what's going to add to long-term relief. Dr. Sella found that this was the most active muscle at the hip joint. Very important point. Now, postural clues, how might you know that you've got a problem here? Again, the tilt to the pelvis, and it's part of Tom Meyer's superficial front line. Again, studying that, you'll see that tightness anywhere along the front there can maintain the tightness in your rectus femoris. So there are other muscles that you might want to look at. Common diagnoses, oftentimes you'll see a patient with a complaint of chondromalacia, that type of a diagnosis. And again, that's going to be a muscle tightening and shortening issue oftentimes with people. Any kind of knee pain, low back pain is very important. Osgood-Schlatter's, again, a number of diagnoses that refer or are part of problems with the rectus femoris. Let's go now to the technique section and see what we can do about those. We're going to next go into treating the rectus femoris muscle, and one of the big reasons we treat the rectus femoris muscle is because its effect on the angle or tilt of the pelvis. Very oftentimes when there's an anterior tilt to the pelvis, it's created in part by a tight rectus. Now, the rectus also causes a referred pain pattern over the middle portion of the knee. So that makes this very important. Also, going up and down stairs, the rectus and the underlying vastus intermedius both have an effect causing pain going up and down the stairs. So again, a very important practical reason. So what we want to do is test the range of motion, come over the side, and ideally what we should see is the heel should touch the buttock. And as I bring that back, what we want to make sure doesn't happen is the knee doesn't come up. That would be a substitution. That's when we know that we're far enough. So we're just going to go ahead and bring back. Another important point for this, some people like to grasp around the foot and tip the heel back. We don't want to be doing that. We're just going to come in front of the ankle and come back, and that's where we stop. So that's where we're going to want to spray from. And so we'll be spraying here. I need to take in a deep breath, please. And exhale. And coming right down the center of the muscle as we come, taking up the slack as we go. Good. Deep breath in again. And exhale. And again, notice how we're trying to bring the spray next to where the other one was. And again, deep breath in and exhale. There we go. Okay. And then we'll see the change in the range of motion, and we're significantly closer than where we were before. That should have a nice change in the tilt of the pelvis at this point in time, as well as any pain that might have been in the knee. Okay. After we're done spraying the muscle, we need to go ahead and apply the moist heat to the area to relax it. The other thing we need to do is give it a stretch. So the stretch that we would be looking for the rectus would be for the person to lean over, pick up their ankle, and straighten back up here. Then we get a nice stretch through the rectus femoris.